In this video, we'll dive into two key aspects of breastfeeding: a comfortable nursing position and how to handle breast cracks or fissures. First, discover the lying position on the side, ideal for rest and recovery. Then, learn about nipple fissures, their causes, and simple ways to prevent and heal them for a smoother breastfeeding journey. Let's get started. Lying position on the side. This position is particularly beneficial for mothers recovering from a cesarean section or an episiotomy that is still painful. It also helps promote the baby's sleep and allows the mother to rest. To make yourself more comfortable, you can use cushions behind your back, under your head, and between your knees. You should feel relaxed without any muscle tension. Lay your baby on their side, snuggling them against you with their back supported by your forearm. Ensure that your baby's belly is touching yours and that their nose is at the same height as your nipple. This ensures the baby doesn't have to twist their head to latch, which can be uncomfortable. Make sure your baby's ear, shoulder, and hip are aligned. The baby's bottom arm can rest under your breast or wrap around your waist to keep them close to you. You may also place a folded towel, a small rolled blanket, or a small pillow behind the baby's back for additional support. When your baby opens their mouth wide, tickle their upper lip with your nipple and quickly bring them closer to your breast. Avoid leaning toward your baby. Instead, gently push their head closer by supporting their shoulder blades with the palm of your hand. This prevents you from adopting an uncomfortable position. Avoid pressing on their head, as it is sensitive and might cause them to reflexively pull away from the breast. If your baby seems uncomfortable, don't panic. Avoid pressing your fingers on your breast, as this might block a milk duct. Instead, try bringing the baby closer by pressing their buttocks against you. This will naturally adjust the angle and clear their nose for easier breathing. Breast cracks, also known as nipple fissures, are painful cracks or splits that can develop on the nipple, often appearing on one or both breasts. They are commonly caused by breastfeeding, especially if the baby isn't latching properly, but they can also result from chafing, dry skin, or other irritations. These cracks can range from small red lines to deeper fissures, sometimes even leading to bleeding. While they can be uncomfortable, the good news is that they are treatable and preventable with the right care. Let's dive into how you can avoid and heal cracked nipples to make breastfeeding a more comfortable experience. At the beginning, there may be no visible signs, and it might seem like nothing is wrong. However, as you start breastfeeding, you'll notice a slight pain when the baby sucks. If nothing is done to prevent it from getting worse, small red lines may appear on the surface of the nipple, or cracks might develop, sometimes even leading to bleeding. So, it's important to take steps early to avoid this discomfort. First, it's crucial to position your baby correctly. Make sure your baby is facing the breast directly, so they're not pulling or pinching the nipple. A good portion of the lower areola, the darker area around the nipple, should be covered by your baby's mouth. Their lips should be flanged outward, and their tongue should be under the breast, not just at the tip of the nipple. This helps reduce pressure on the nipple itself. If you need to clear your baby's nose to help them breathe, don't pull on the nipple with your fingers. Instead, bring your baby closer by pressing their bottom against you, and their nose will naturally clear. Another key tip is to avoid overwashing or overdrying your nipples. Doing so can strip away the natural protective layer of fat that keeps the skin healthy. Cleaning once a day with a mild soap is plenty. Also, wearing a well-fitted bra can help prevent friction, which can irritate the nipples further. When it's time to remove your baby from the breast, gently slide a finger between their gums to ease their mouth off the nipple. This helps avoid unnecessary tugging. After each feeding, try expressing a few drops of breast milk and spreading it over your nipple. Let it air dry before covering your breasts. Breast milk is amazing. It hydrates, protects, and helps heal the skin. In fact, it's more effective than any cream you could buy. Now, if you already have a crack, don't worry. There are ways to treat it. Start by varying your breastfeeding positions. Moving your baby's mouth to different spots can help rest the area where the crack is located. You can also create a milk dressing to help it heal. Just express some breast milk, soak a sterile compress, make sure it's larger than the areola, in it, and place it over the nipple. Cover it with plastic wrap and secure it with your bra. Change the compress before each feeding until the crack heals. This means replacing the compress with a fresh one every time before you breastfeed your baby, and you should keep doing this until the crack is fully healed. This helps keep the area clean, promotes healing, and ensures the treatment remains effective. Even if you notice a little bleeding, it's safe to continue breastfeeding. Don't worry if your baby swallows a small amount of blood. It's not harmful. But if the cracks are really painful, you can temporarily use a nipple shield or express your milk manually or with a pump and feed it to your baby. This gives your nipples a chance to heal while still providing your baby with all the nutrients they need. Thanks for watching, and remember to like, share, and subscribe for more health tips.